My name is Udi. I am a pediatric hemato-oncologist and I specialize in bone marrow transplantation. I studied medicine here in Jerusalem and I specialized in pediatrics here in Jerusalem in Shaarei Tzedek Hospital. I have done a subspecialty in pediatric hematology and oncology at the Schneider Hospital. My main focus was on bone marrow transplantation. I fell in love with this practice because I think we can actually do miracles with bone marrow transplantation, and it's something I enjoy very much. So after 5 years working in Schneider, I went for a fellowship in the Hospital for Sick Children in Toronto, where I specialized specifically in bone marrow transplantation in pediatric patients. In these 2 years, I saw many patients because this is a very big center, and I gained a lot of experience in the field. And then Professor Stefanski recruited me to Hadassah. And since then, I'm here at the department treating pediatric patients with a wide variety of hematological, malignant and non-malignant diseases. We have a very unique department because it's a combined department of adults and pediatrics. We have a lot of experience with bone marrow transplantation, specifically in pediatrics. Most of our pediatric patients have non-malignant diseases which need bone marrow transplantation, but we also have a lot of leukemia patients. My main interest and focus in research is the bone marrow failures, including aplastic anemia, Fanconi anemia, dyskeratosis congenita, black van Diamond anemia. But we treat a lot of other diseases as well. Many patients with osteopetrosis we have, many metabolic diseases. So genetic diseases are diseases that you are born with an inborn error of metabolism, with a genetic defect that may cause problems that sometimes require bone marrow transplantation. For instance, immune deficiencies, very severe immune deficiencies, or metabolic diseases, or diseases which cause bone marrow failure. And the main reason is a genetic defect, which may be a result of inheritance or just a mutation. And sometimes bone marrow transplantation is the cure for these diseases. So first of all, we need a proper diagnosis. For a proper diagnosis, many times we need to do a whole exome sequencing or some kind of a accurate genetic diagnosis. Before transplant, we do a series of a lot of blood tests to see their medical status and to see if they're fit for transplant. We have a lot of patients, so we have a lot of experience. Our department is very unique because it's a combined adult and pediatric department. So our nursing staff is very experienced in the field of bone marrow transplantation. Pediatric and the adult physicians, we work together so we can share ideas, and we have joint meetings, and there's a lot of synergism in this combination. So if we're looking at the pediatric bone marrow transplantation, we do between, I'd say, maybe 30-40 transplants per year, and we have a wide variety of diseases. Like I mentioned earlier, we have leukemias, genetic diseases, bone marrow failures, metabolic diseases. We have a large variety of diseases. We have all of the disciplines required here for giving the best support for the patients, including gastroenterologists. Also, we have a very big pediatric cardiology team, a very big pediatric neurology team. We have all the necessary resources for giving the best medical support for our patients, which is a very big advantage working in a big center. So the nice thing about the pediatrics is that the pediatric patients, they have an amazing ability to recover, to cure themselves as compared to adults. So our success rate is very high. So in many cases, the cure is complete. Miraculously, they get cured from their disease. Coming to Israel for a bone marrow transplantation is a very big deal, because bone marrow transplantation is not a picnic. It's a very difficult time, because a lot of the time is spent here in the hospital, far away from home. So we have many patients that come from abroad for bone marrow transplant, and we give them all the support they need, including social support and medical support and whatever they need. And we do our best to make this time period as bearable as possible. And it's very fulfilling, and it's very nice to see them when they go home with a cured child, and it's very satisfying.